The knee is the largest joint in the human body. There are three main bones, which are the femur, the thigh bone, the tibia, the shin bone, and the patella, or the kneecap. The fibula, the smaller bone on the outside, is less important. The way it works is essentially a hinge, as you can see in this model, but it's more complex. There is a rotational element to it.
The interesting thing is, you go into A&E and you have an x-ray of your knee and you see the two bones, but you see this big space in between the bones, and the x-ray doesn't pick up the very important soft tissue structures that line the joint, and that's the joint surface cartilage and the meniscal shock absorbing cartilages. We have one on the outside, which is the lateral meniscus. We have one on the inside, which is called the medial meniscus. So keeping this bone from this bone is a layer of three structures, and those soft tissue structures are the gap that you see when you look at your x-ray of a knee.
And the whole thing is held together by various ligaments. The medial and lateral collateral ligaments that stop the knee wobbling from side to side, and then in the middle of the knee, the anterior and posterior cruciate ligaments, which prevent the knee from wobbling forward and back, and more importantly, rotating. The patella itself is what we call a sesamoid bone, so it's within a muscle. So the quadriceps muscles, which are here at the top, insert onto the kneecap and allow you to straighten the leg. And it's very important the patella to be intact for good knee function.